Hi, this is Dr. Tim Conley at Wurzweiler School at Yeshiva University, and I'm recording this lecture primarily for my students. Feel free to keep listening, student or not. Dr. C is always willing to talk about theories on the etiology of addiction. Where did it come from? How did people become addicted to begin with? Nobody generally says as a child, hey, what I want to be when I grow up? I'd like to be addicted, or I'd like to be an addict. It's just not generally something people aspire to. It's something that happens to people. I'm looking specifically right now at attachment theory and substance use disorders. In fact, I'm looking at an article called Attachment and Substance Use Disorders, Theoretical Models, Empirical Evidence and Implications for Treatment by Andreas Schindler. This is in the journal Psychiatry, 15th edition, October of 2019. And basically, the article is reviewing all of the studies that have been done, every empirical study, longitudinal, cross-sectional, every study that's been done to try to say, what is the role of attachment in the development of addiction? Do individuals who have insecure attachment as a child later become addicted? Is attachment disorder, failure to attach properly as a child, is that the primary predictor of who's going to develop a substance use disorder? Questions like, if you experience insecure attachment as a child, is it going to cause you to become addicted later? Because that word cause comes up a lot, and we want to take a look at what the relationship between them is. And I think the study does a really good job. I think it's leaning a little bit towards trying to support attachment theory, but it definitely provides a good critique. Attachment theory suggests a developmental pathway from insecure attachment to SUD. Developmental pathway. Early reviews have indicated I'm quoting, a general link, but have been inconclusive with regards to other aspects. So clearly it's looking at literature which says that there is some link and there's some role of attachment in SUDs. And what is that? And it reviews 34 studies. And they all confirm a link. But words like linked to, associated with, correlated, etc., those come up repeatedly, but at no point, be clear, at no point does really anybody say attachment theory causes addiction. And I'll give you a view of where I'm going with this. The misconception that my students sometimes are the misconception is that if an individual has insecure attachment patterns, and that is causing their substance use disorder, and I cure the insecure attachment patterns and they learn to attach more securely in life, then the substance use will go away. As I've said with many other co-occurring disorders, you don't treat one psychiatric condition and have another psychiatric condition go into remission. You can't treat attachment and have the SUD go away. You can't treat the depression or anxiety or PTSD or trauma and have the SUD go away. Substance use disorder is a primary diagnosis that really has a life of its own. But let's go back to attachment. So a general link, again, that word link, is between insecure attachment and SUD is well established. But the article makes real clear, and I'm still in the abstract, that to confirm that link, a lot of open questions have to be answered. And I don't think the article really goes on to answer them. I'm going to scroll down and say, again, I'm down on page, I don't have a page here, but I'm in the section that says discussion implications for research and treatment. There, a general link between insecure attachment and SUDs. I give that. I will agree. It is a risk factor for SUD, a risk factor, not the risk factor, not the primary, not the most highly associated risk factor. It is a risk factor, as is genetics, environment. There are a host of other sociocultural, socioeconomic risk factors that go into substance use disorder. There's evidence for a negative impact on substance abuse on attachment. I can go with that one. Individuals who are addicted to a substance suffer what DSM-5 says is impairment in social, occupational, and recreational functioning. There's difficulty with relationships, et cetera, et cetera. People tell them to cut down. The ability to form a meaningful, lasting, emotional, even intimate attachment to another person is impaired by substances. You can't be fully present with somebody when you're fully present, when you're fully impaired by, say, alcohol or methamphetamine or opiates, for example. Scrolling down on implications for treatment, the author makes clear we are still at an early stage, lacking an integration of attachment in a model of SUD, lacking treatment concepts in clinical trials. Should treatment consider insecure attachment as a factor? Yes. Did it come before the SUD? Did it develop after the SUD? Either way, we do want to work on relationships and intimacy, the formation of intimate psychological, emotional relationships with people, regardless of the etiology, where it came from. And here the author concludes methodological problems in the assessment of attachment and substance abuse limit comparability. There's a tendency in many studies to focus on attachment as a single variable and to disregard its context and possible confounds. Future research will have to compare different groups of substance abusers systematically, including severity of use, comorbid disorders, linking psychological and neurobiological measures, et cetera, et cetera. I'm going to head into another critique on attachment theory and substance use in a minute. But first, just a note on my own professional history with attachment theory. I have seen the theory misused. Biology is not destiny, and attachment theory, posits that an individual who fails to form a secure, emotional bonding and attachment with the maternal figure in the earliest stages of life, and it has then some compromised neurobiology that's going to make it difficult for them to attach throughout life. I don't see the empirical studies for that. I don't see it as science. I see it as an ideology, as a theory, just what it is, a theory, lacking empirical support in general. The dangers of attachment theory, one I already pointed out, thinking that if I cure the attachment, I'm going to cure the addiction. No, we have to deal with attachment issues, but we're not going to cure anybody's addiction by doing so. Two is blaming the mother. And there is gender bias that creeps in here. There is it's the mom's fault if somebody has become an addict. It can be very troubling that way, in that it doesn't look at the context in which people are parented, and doesn't take a look at really what's going on with the circumstances that a parent may be in, and their ability to form an attachment. So be careful with the history of attachment theory. If you dig in deep enough and want to go far enough, you will tie it right back into psychoanalytic theory, which talks about the mother-child relationship being deterministic for personality and a variety of other issues. Now, onto a critique by Philip Flores. He's critiquing addiction and attachment theory, a book that was written in 84, and I just want to echo him before I finish up this mini lecture here. There is very little, I'm quoting, there is very little, if any, empirical research to support a claim of attachment theory being deterministic or causal of addiction. In fact, supporters of attachment theory take a giant leap when they extrapolate from attachment research done with children to draw conclusions about adult attachment in general. And addictions research suggests that addictions are complex, multifaceted phenomena with biological, psychological, and yes, some social risk factors and factors associated with it, but it cannot be reduced to a simple singular cause. The critics' worry was that naive readers may adopt a simplistic reductionist view, and I know that my students won't, and our students won't. We can't conclude that all we have to do to treat substance use is to effectively help the afflicted form attachments to the therapist and to other people. So, We know that substance use corrupts the brain. It impairs an individual's ability to function socially and in relationships. We know relationships with loved ones and family members and others, significant others. We know that they're tremendously impaired by substance use, um, and we know that. Not being able to get your needs met in a warm, loving human relationship can put a person at risk for substance use. Be careful with it. Be careful for the conclusions and the degree to which um, speakers and authors are going to attribute addiction to attachment. The empirical evidence simply is not there.